All right, let's jump right in. Today, we're talking about one of the most common things you'll see at the pharmacy counter, that red, swollen eyelid. We're going to build a really clear, practical framework to help you assess, manage, and counsel your patients like a pro. Okay, let's get into it. So, you know the scene. A patient walks up, points to their eye and says, "What is this? And what can I do about it?" Being able to help them figure out what's going on, well, that's the first and most critical step, right?
So here's our game plan. First, we'll nail down the differences between these conditions. Then we'll dive into managing those acute lumps and bumps, styes and chalazions. After that, we'll tackle the trickier long-term control of chronic blepharitis, and we'll wrap it all up with the most important counseling points you need to know.
Let's get right to the heart of it, how to tell these three apart. Honestly, having a clear mental map is the key to giving the right advice from the get-go.
Okay, this is basically your cheat sheet. Just look at the onset. A stye is acute. It pops up over a couple of days. A chalazion is more gradual. We're talking days to weeks. And then you've got blepharitis, which is this chronic thing that builds over weeks to months. That timeline alone is often your biggest first clue.
So here's the bottom line. If you remember one single thing to tell a stye from a chalazion, it's this: pain. A stye is an acute, painful infection. A chalazion is a sterile, painless little lump from a blocked gland. Just asking the patient, "Hey, is it tender if you touch it?" can pretty much give you the answer right there.
Okay, so now that we can tell them apart, let's talk about what to do. We'll start with the two acute issues that patients are most likely coming to you for right away: styes and chalazions.
First up, the stye, which you'll also hear called a hordeolum. This is the most common eyelid infection out there, usually caused by good old Staphylococcus aureus. It's basically a small, localized abscess, and our main goal is just to help it drain.
Now, the good news is most of these styes drain all by themselves within about 48 hours. Our job is to guide the patient on how to help it along. And this is the process right here. Warm compresses to soften everything up, a little gentle massage to encourage it to drain, and then just simple cleaning once it's done. And here's a key point: non-prescription antibacterial drops, totally not necessary.
Now here is a fantastic and kind of funny counseling pearl you can give your patients. A study actually found that a hard-boiled egg wrapped in a cloth holds heat way better than a standard washcloth. It's a super cheap and effective tip that people will definitely remember. And here is our critical red flag. Super important. While most styes get better, if there's no drainage within 48 hours of starting those warm compresses, it's time to refer. That patient might need a doctor to go in and drain it.
Okay, let's pivot to the chalazion. Remember, this is our painless, rubbery nodule. It's not an infection, it's a sterile inflammation, because a gland got blocked up, and it develops much more slowly, usually over a few weeks. So, management starts the same way: warm compresses. But, and this is a big but, this is where your counseling has to be different. Since it's not an infection, you have to stress that those antibacterial drops will do absolutely nothing. The referral triggers are different too. Tell them to see a doctor if it's not getting better after a few days, and to go immediately if they have any eye pain or changes in their vision. That could mean it's getting big enough to actually press on the eye.
All right, let's shift gears from those acute bumps to the chronic and, frankly, super frustrating condition of blepharitis. This is not about a quick fix. This is all about long-term management and really good patient education.
You know, when a patient has blepharitis, this is what they are dealing with every single day. That constant gritty, burning feeling. It's especially bad in the morning when all those inflammatory mediators have been sitting on the eye surface all night. Understanding this is so key to having empathy and really stressing why they need to be consistent with their care.
For blepharitis, the absolute cornerstone of care is this three-step process. This isn't a do-it-for-a-week treatment. This is a long-term hygiene routine. Warm compresses to melt those gunked-up secretions, gentle cleansing of just the lid margin, and a firm massage to express the glands. This is the foundation of absolutely everything.
And this slide, this says it all. We can talk about medications all day long, but if the patient is not doing this lid hygiene routine consistently, the treatment is going to fail. Period. This is probably the single most important message we can deliver as pharmacists. The condition is chronic, and so is the therapy.
Now, during bad flare-ups, medications do have a role. For anterior blepharitis, an antibacterial ointment like erythromycin right on the lid margins can really help. For really bad inflammation, an eye care professional might prescribe a short course of topical steroids. They often prefer something like lodiprednol because it has a lower risk of messing with eye pressure.
Our job is to reinforce how to apply it and stress that it's a short-term fix.
Okay, let's bring this all home. We'll pull it all together into a final set of high-impact counseling points that are going to empower your patients to really manage their condition. All right, here it is, your final counseling checklist. First, for any infection, it's hygiene, hygiene, hygiene. Wash hands, don't share makeup, and toss out old makeup and contacts after it's cleared up. Second, for blepharitis, you have to hammer home that consistent, long-term lid hygiene is completely non-negotiable. And finally, for styes and chalasia, repeat it one more time. OTC antibacterial drops are not the answer. Simple warm compresses are the star of the show.
So I'll leave you with this question on the screen. For chronic blepharitis, what's the single most important factor for treatment success? When you see that patient with those red, irritated eyelids, just remember, while products and prescriptions have their place, the real key to success comes down to one thing: the patient's consistent, daily adherence to that lid hygiene routine. Your counseling on that one point can make all the difference in the world. Thanks so much for joining this explainer.